Good morning, everybody. My name is Sarah O'Flynn. Welcome to the webinar this morning. I would like to start by just highlighting that this webinar is being presented in English, Spanish, French, and Arabic. So if you would like to listen to the webinar in a different language other than English, please do look for the globe sign at the bottom of your Zoom screen and choose the channel that you would like. Great. So once again, I'd like to welcome you all to the meeting. This presentation will be focusing on tools intended to strengthen frontline public health services during COVID-19. We've developed a number of tools to support frontline health and nutrition workers that we're excited to be sharing with you today. So just to get started, I'll do a brief introduction just so we can set the scene a little bit. The objective of the webinar is to do exactly that, to disseminate and share tools and to demonstrate how they can be used and their usefulness, utility in the field. We'll be going through a very brief introduction and then bringing together a panel. The first part of the panel will be talking about the need that was identified and that we hope that these tools will respond to. We will then have a launch of the tools and then follow with a final panel session, again, asking questions around how these tools could be used to strengthen public health services on the front line. These products were developed in a project funded by USAID, BHA, the Bureau for Humanitarian Assistance. The project was designed in response to what we were seeing last year as a real need coming from practitioners who are working directly with caregivers during the COVID-19 pandemic. We know that COVID-19 has impacted nearly every nation, every community around the globe. We also know that, of course, due to COVID-19, in addition to, unfortunately, the morbidity and mortality associated with COVID, that there have been major disruptions in public health services and in access and availability to those services. So in response, Save the Children and partners came together to develop, and I just want to take note of the partners down there at the bottom of the screen. These organizations were all involved in the development of these tools, so I do want to recognize and thank them all. In response to that need that was identified, we developed a set of tools through this project. The first, and that we're particularly excited about, is an interactive digital platform providing access to the most updated resources with a focus on infant and young child feeding, but to be fair, also including other topics around infant and child nutrition and other public health areas. We also developed a set of microlearning videos. We'll be able to show you one of those videos during today's call. And finally, a set of guidelines. And these guidelines, though they were developed around infant and young child feeding, are relevant across public health. These are around e-counseling, how to provide counseling services to care providers in this remote environment or amid other restrictions due to COVID. They are around home visits in a similar nature and support groups. So without further ado, and I should say that similar to this webinar, all of the tools are available in English, Spanish, French, and Arabic, which we hope will help them to be as accessible as possible to those who are providing the care directly to mothers, families, and care providers. I'm very pleased to be able to introduce the panel that will be discussing these topics with us today. We start with Andrea Garcia. Andrea comes to us from the Save the Children Country Office in Colombia. Andrea has a degree in nutrition and food science, a specialist degree in food and nutrition and health promotion. She has a master's in genetic, nutritional, and environmental factors for growth and development, and she is also a breastfeeding counselor. She has worked as a research assistant at the National Institute of Public Health, responsible for a school feeding program and particularly for innovations in that area. She has worked on the health and nutrition component for early childhood development care at the Early Childhood Care Institution and has developed prevention and promotion activities for pregnant and breastfeeding women. She currently coordinates the nutrition component in the Save the Children International program in Colombia. Second, I would like to introduce Olive Mutamia. Olive works with Save the Children International in Nigeria. She She has over 10 years of experience in maternal and child health, nutrition, and nutrition programming and development and emergency contexts. Olive has a degree in community nutrition and a master's in applied human nutrition. In the last 3 years, she's been leading Save the Children's efforts in Northeast Nigeria in the nutrition sector, with a strategic focus on promoting maternal, infant, and young child nutrition during the first 1,000 days of life. In the last year, Olive has delivered on adaptations to nutrition programming in order to effectively respond to the COVID-19 pandemic. Olive is passionate about ensuring that all children have access to core basic services to support a strong foundation in life. Welcome to Olive. Next, we have Linda Shekhar-Birbari. Linda comes to us from the IFE Core Group, the Infant Feeding and Emergencies Core Group Facilitator and a consultant with the Emergency Nutrition Network. Linda has more than 18 years of experience in the area of community and public health nutrition with a focus on infant and young child feeding and emergencies. She has been engaged in community nutrition programming, planning, development, monitoring, and evaluation, as well as policy, strategy development, and research. And last but not least is Alessandro Yellemo. We call him fondly Alex, and he goes by Alex. Alex is currently the global advisor on infant and young child feeding and emergencies for Save the Children. He has extensive expertise in infant and young child feeding policies and practice, particularly in emergencies, and on the WHO International Code and other global rules. Previous to working with Save the Children, he has been working with UNICEF and WHO. So I'd like to welcome our panelists to today's session. We're really appreciative of your time this morning to discuss the challenges and the ways that these tools can be helpful in delivering nutrition services and general public health services during the COVID-19 pandemic. So without further ado, I might take down this presentation and open us up for the panelists to be on video so we can see everybody a little bit larger. That's all right? Aye, great. Yes, and apologies. I might just slow down my my speech so that everybody can catch all that I'm saying. Thank you for that comment. So to start out, we did just want to have a bit of a discussion about the challenges that were faced in frontline public health services during the last year, or the last, has it been 15 months, let's say. And to open that up, I would like to pose a question overall around the challenges and issues faced by practitioners who are working with care providers, mothers, and families during the COVID-19 pandemic. Specifically, I'll send a question over to Andrea around the challenges that she found in providing counseling around infant and young child feeding counseling services after the onset of the COVID-19 pandemic.
Thank you, Sarah. Well, in Colombia, in March 2020, the national authorities ordered restriction of mobility. That meant that we were not able to go out of our houses, and we could also not organize all our IYCF bill activities. We basically had a restriction of movement, so that was our big and main challenge.
Sorry, I was trying for background noise. Thank you, Andrea. Olive, we have a similar question for you around the provision of support through support groups. Can you talk a little bit about the challenges that you faced with the onset of COVID and delivery of these services? You're just on mute, Olive.
Thank you, Sarah. In around March 2019, the first COVID-19 case was detected in Nigeria, and that led to the government closing down, and that also affected nutrition activities, including the infant and young child feeding interventions. Due to the lockdown, the health workers were not able to get to the locations and provide the services, and also the stigma that was around it because of the little information that was available. at the moment, also affecting the IYCF interventions at that moment. Thank you.
Thank you for those concrete examples. And Linda, do you have anything to add from your perspective and visibility for the Infant Feeding and Emergencies core group? You have a very valuable perspective overall for what some of the challenges were that were being raised.
Yeah, thank you, Sarah. So as you mentioned, I'm representing the IFE core group, which is a global collaboration of agencies and individuals concerned with the protection of infant and young child feeding in emergencies. And the challenges that we faced at the onset were really about the need to understand the challenges that are being faced, you know, by the collective, by countries, by agencies and practitioners in the midst of the pandemic. And to address that, we tried to start collating, you know, and compiling questions from country offices and agencies via different channels. And I can maybe summarize that at the time, the challenges that were communicated revolved around two main themes. And the first of which was related to the actual recommendations in the midst of COVID-19 and breastfeeding and infant and young child feeding, but more specifically breastfeeding, you know, the transmission, the recommendation, specifically, what do we tell breastfeeding mothers, right? So that was the first challenge or theme. And the second one was more related to the operations, the precautions that needed to be taken in programming and the adaptations that needed to be put in place amidst the restrictions, right, that Andrea and Olive were mentioning. So these were the two main themes that came at the beginning. And we tried to continue collating these challenges, and I'm happy to elaborate on that in a bit if you want. Thanks.
Thank you very much, Linda. Yes, it sounds like, and I think that was also reflected by many who are likely on this call, the challenges around how do you maintain services during the COVID-19 pandemic, how do you maintain that important connection with mothers and care providers, that they know what services are available, that remain available to them. But then also, as health and nutrition workers, how do we safely provide those services within the restrictions and respecting the restrictions to keep everyone safe? So thank you for that initial response to the questions. I will now hand over to Alex, who will describe some of the tools and our attempts to respond to some of these challenges and to make sure that these answers or these skills and tools are in the hands of those who need them the most. So I'll hand over to Alex. Thank you.
Yeah, thanks, Sarah, and also the other panelists and all the colleagues on the call. I think, yeah, maybe a word before jumping to the tools. I think it was really what you said, no? One is ensuring the safety, meaning ensuring the operations, the programs, the activities would continue. And we have heard that from Olive, for example, that was a main initial challenge, right? How to continue those activities, but in the safest possible way, both for those providing the service and and the population, the communities that were accessing the services. But plus there was also some other ask, no? How do we continue, for example, capacitating our teams? How do we continue providing support while we cannot access our communities, no? So, and I think these are just the details of some of the, you know, unpacking those themes that, for example, Linda was mentioning. And really the idea, really the collective idea and the right important partners that contributed to the whole process of developing the tools, of trying to answer to some of those very specific questions, no? So, and one of them is, how do we keep our health workers, frontliners, community health workers, volunteer up to date with information that may be issued by WHO, no? How do we give them, how do we help them get the right message and make them understand when we can't be with them? And the answer was an initial answer. We know that may not answer all the needs, to create what we call the micro-learning videos, no? Those videos that we feel are attractive, that simplifies the messages, but provide the right messages and can be shared through different platforms. And we will see one platform later. so that any frontliner can access the video and receive the right information in different languages, understand the recommendations, understand how to keep himself or herself safe, but still providing the service. So I would like all of the participants to sit tight and enjoy one of the two videos, and Ryan will play just to show what is a microlearning video and how we can keep providing capacity support to our frontliners while we are not close to them. Thank you, Ryan.
Breastfeeding, hygiene, and safe complementary feeding protect children during disease outbreaks, including COVID-19. During an outbreak, there are a lot of myths and misleading information around how to feed infants and young children. Parents may be confused and not know what to do. It's more important than ever to support caregivers. In this video, you will learn how to advise caregivers on how to feed their infants and young children during the COVID-19 pandemic using 4 key messages. These 4 key messages are important to remember and to use when you counsel mothers and caregivers. Your goal is to help children in your community be well nourished, to protect against illness, and grow up healthy and strong. The 4 key messages to counsel mothers and caregivers of young children are: wear a face covering when caring for or feeding a young child if you have a cough, breathing difficulties, or a known COVID-19 infection. Mother and baby should stay in the same room after birth, including during the COVID-19 pandemic. Continue breastfeeding during COVID-19 from birth to 2 years and beyond. Practice hygiene and safe complementary feeding practices. Any mother or household member with a cough, difficulties breathing, or a known COVID-19 infection should wash hands and wear a face covering. This will help prevent passing on the COVID-19 virus. It's important to support mothers to room in with their baby after childbirth, even if the mother or baby is suspected to have COVID-19. Keeping the mother and baby together supports early and exclusive breastfeeding and mother-baby bonding. This gives a baby its best start at life. It's important to encourage mothers with a young child to continue breastfeeding, even if they have COVID-19, as the virus does not pass through the breast milk to the baby. This means a mother with COVID-19 can continue to breastfeed without getting the baby sick. In fact, breast milk has nutrients which protect the child from infection, diarrhea, and illness. Remember, any mother with respiratory symptoms or a known COVID-19 infection should wear a face covering while breastfeeding to protect her child. Breast milk contains all the nutrients an infant needs in the first 6 months of life. Initiating breastfeeding within the first hours of life, feeding the baby only breast milk for their first 6 months, and continuing breastfeeding to at least 2 years protects a child from illness. It is especially important during the COVID-19 pandemic to counsel mothers and caregivers of young children on practicing hygiene and safe feeding practices. Encourage them to wash their and their children's hands before and after feeding their baby or child, clean utensils, bowls, and cups before and after eating, and serve food immediately after preparation in order to prevent infection. Caregivers should wash their child's hands frequently with soap and water once they are crawling, walking, and eating with their hands. It is also important to regularly clean surfaces in the house. This will help protect children from COVID-19 and other infections. These are the 4 key messages to remember to pass on to mothers and caregivers about infant and young child feeding in the context of COVID-19. 1. Mothers and caregivers with respiratory symptoms or confirmed COVID-19 should wear a face covering or mask while feeding or caring for their young children. 2. Mothers and babies should room in together after birth, even if one of them has COVID-19. 3. Breast milk does not pass COVID-19 virus to the child, and it has nutrients which protect against infection. Mothers should continue to breastfeed from birth to at least 2 years, even during COVID-19. 4. Proper hand washing with soap and water before and after feeding or caring for a young child, and keeping surfaces in the home clean is critical to prevent infection.
Thanks, and thanks, Ryan. So this is one of the 2 microlearning videos. Again, as you can see, contains the key messages, the key reminders to all our frontline staff, and can be easily accessible. We will see, and there are several ways of accessing it. The second microlearning video, we don't have the time to share it here, but you can access it, and the link will be pasted in the chat, I hope, or if it has not been done yet. It's really about giving the recommendations around how to continue counseling our caregivers, but maintaining in full compliance with the COVID-19 recommendations. This is in case of in-person, face-to-face counseling. So these are the 2 microlearning videos, and again, they are available across 4 languages: Arabic, French, Spanish, and English. The second major product, and allow me to share the screen, is, I do hope all of you can see the screen, is the IYCF hub. Now, it's a global repository, that's the intent, of essential infant and young child feeding, infant and young child nutrition in emergency resources. It's the place to go where anyone, any program manager, any nutrition officer, any health worker, any community health worker that is able to access the platform can use to retrieve relevant resources relevant to his work, relevant to her work, relevant to her questions. I will just briefly introduce the platform from top down. You will see there is an introduction. Then the platform of the hub gives you the opportunity to search according to, one, you can search just entering the topic or the region or the country of interest. So it's an open search, and I will show you one example in a while. The second, you can just eventually click a topic. You can select any of your targets. You can select a challenge. Many resources are also tagged or linked to specific challenges. Or you can, if interested, look for resources in a particular country. The importance here, and then of course you will have to click find the resources as interested. What we have also ensured is that the platform or the hub provides some pre-organized resources according to key topics. And this follows, for those that are familiar, the IYCF toolkit structure of Save the Children. So there are at least 9 collections for the hub. We call them collections. And so if you're interested on materials or resources related to any of those topics, maybe this is a way to start reviewing those that were already organized under each of those components or those topics, including, for example, policy, staffing, developing proposals, and so on and so forth. The last part of the hub page is it allows any user to decide if you want to be kept up to date on any new reference or resource that is being published in the hub, just clicking the topic and eventually entering some of your information, as you can see from the screen. I will not do it now because time, unfortunately, is not with us. Lastly, the hub soon will also contain important information around events like this kind of webinars. And at the bottom of the page, you will have a chance to connect with us. You have a chance to create your own library of resources. Basically, you can save the resources you like in your own account. And to do so, you will have to register in this way. At the same time, and this is what we feel one of the main components or one of the main utility or facilities of this hub, you can also contribute, and we will encourage all the countries to suggest resources, references, documents, and tools that you have been developing or that have been developed in your country that you can suggest to be included eventually in the hub. And this is the form that will be needed to be filled up for you to suggest your reference. Again, we are extremely thankful for all the partners that you can see here that have been working hard with us to come out, to help us come out with this platform. Let me go quickly on the top. So again, it's a platform that, again, if you want to search for any material, or for example, from a practical guideline, the platform will retrieve any document that contains some of the words that have been included in the search, the toolbar, the search bar here. You can also further refine your results by priority, by year of publication, by topic, by who has published it. If you have specific interest around some agency that has published some resources, by type of content. I'm interested in manuals, I'm interested in policies. This menu on the side will help you refine your search so that instead of having 50 documents to review, you can eventually narrow down to the one you need. No? Let's assume I need this practical guideline. And you will click on the title. So this is, I'm showing you how to search for this tool. And this is one of the 3 guidelines that SAVE and all the partners, ENN, IFE Core Group, PAT, Safely Fed, Canada, IYCF US, with the support of USAID, have been developing. And so when you enter in the specific page of a resource, you can decide, you have a lot of choices. You can decide what to do with it. You can share it through different social media platforms, as you can see. You can share it using your email. You can copy the link and send it again through an email, or you can click in this small book here. You can save it in your library. Obviously, what you can also do, and maybe that's what generally we want to do, is to download it. And you can just click on the download button, the language of the language you prefer. No? Some of the materials are in multiple languages. So you just need to click and and download the resource. Or, as I said, you can share the resource. So for you to be aware, this platform is now live, but we are entering a very soft launch. No, you can in a very soft launch. So if you are able to access, you try to navigate, please be aware that it's a soft launch. There may be still a few things to improve, but generally we are extremely proud to have shared this at this stage with you all. No, let me. So this is the platform, and anyone can use it from anywhere. And one message that I really missed to inform you all about is that this platform can be accessed. You can access your resources offline as long as they are saved in your library. No, so you need to create a library, and that library can be accessed offline. You can read in the question and answer section of the platform how to save it offline. But I will have to stop now the sharing and give me a couple of minutes to also introduce briefly the 3 guidelines that I already searched through the platform, but to give you more ideas on what these guidelines are all about. The first is about how do we support, no? How can we continue supporting group sessions in the context of COVID-19? It's a very short guideline. It's again in several languages, but really provides the key considerations that will help you and help us wherever you are in ensuring that we comply while complying with the COVID-19 recommendations. Group sessions can continue. No? And again, so there are recommendations to ensure the safety of all the participants and the safety of all the facilitators. But then there are also recommendations, and I will show you the same in the next guideline, so not to duplicate, on what can be done in different scenarios. No? So we have one guideline for support groups. We have also a guideline for home visits. And again, it provides for consideration on how to ensure that home visits can continue during COVID-19 pandemic, but also recommendation on how to do it according to the scenario. So we have a color-coded type of scenarios, and it's the same color coding and the same approach used for the support groups. And you can see that depending on the situation where you are, so there is no movement yet, there is no access, there is prohibition of gatherings and meetings, or there is a limited movement, or there are no restrictions in place, but still we need to comply with COVID-19 recommendations. There are several suggestions according to the specific scenario. So these two guidelines, the support groups and the home visits, have a very similar approach. So general recommendation related to COVID-19 and specific to, according to the three scenarios, activity specific recommendations. Lastly, but not the least, is really about e-counseling consideration for planning and implementation, focusing on phone counseling. It's a very important guidelines. We had more than 20 colleagues. I wish I could mention all their names that supported the development and the improvement. But as you can see, and you will see from the guideline itself, it provides for very concrete recommendations. How can we do e-counseling, phone counseling, infant and young child feeding phone counseling? What are the things that we need to say? What are the things that we need to, how do we engage a woman, a caregiver through phone? No? How can we all create that environment that usually we create in a face-to-face situation? So the guidelines is really helping providing those very concrete suggestions, but always start with an assumption that you need to be trained on breastfeeding counseling and IYCF counseling before eventually providing phone counseling. So again, I'm sorry I cannot extend more my presentation, but basically, as I said, these three guidelines are all available in the platform, and they are all available in the 4 languages. It's a very exciting moment. Please do use it. Please do give us feedback whenever you use it. And thanks, Sarah. Back to you. Over to you.
Great. Thank you very much, Alex. Put my video back on so that you can see me. Great. Thank you very much. I hope that it looks in the chat like there's a lot of excitement about these tools. I'm supposed to keep my thanks till the end of the presentation, but really seeing all of these products, I do just need to thank everybody involved in the creation of these products, to the strategic advisory group that helped to inform the strategic visioning and response and what we wanted to create, to all of the many people who reviewed and provided feedback to help improve all of these tools. It's just a huge thank you, and we hope that they are useful to the folks who it's most important to have them, to the frontline health and nutrition workers. So let us go directly into that. We started the webinar talking about some of the challenges faced in providing these frontline public health services. So I'd like to invite the panelists to come back on video, and we'll just start with a couple questions and answers. We have a fair amount of time remaining that we can really engage and discuss how these various tools can be used and can be useful. So we have a couple questions that I have prepared. I know there are a few questions that have also come through in the Q&A. So please do, as you have questions, please pop them into the Q&A, and I will do my best to represent everybody and have those questions. So perhaps I can start with a general question to Linda. Given where you sit and the visibility that you have on so many important conversations, and mindful of the challenges that you mentioned earlier, how would you find that these tools could help us address those challenges?
Yeah, thank you, Sarah. Maybe I should start off by saying, congratulations again on these tools and resources, and congratulations to all of us. I think I should say really because these tools have been developed by us, those who are passionate about IYCFE and committed to IYCFE. And the participatory approach that was adopted for the creation of these tools was really impressive, and it gives a lot of importance to the value of these tools. So these were developed, as I said, by us, and they're also developed for us, right? For every person who is committed to improving infant and young child feeding in emergencies and in the context of COVID-19. And so congratulations again. And in terms of how they address the challenges, I'll go back also to what I started the conversation by, those two themes, right? If we go back to the first theme of challenges that was identified related to the recommendations, right? We know that at the beginning that there were recommendations issued, the frequently asked questions on breastfeeding and COVID-19. But what these tools are doing specifically on recommendations is actually simplifying them, actually targeting the frontline, the person who really needs it, the person who doesn't really have a lot of time to, compile this information to be able to give it. So I think from that sense, it's really important. And the second bit is really on the adaptations, right? The second theme that we were talking about in terms of the challenges is how do we do that and how do we adapt? And also these tools are so important in that sense because we're going into the nitty-gritty of the how, right? So how do you actually do a focus, a support group, right? So the actual how to, which was an elaboration of the initially developed IYCFE brief, right? At the beginning also of the pandemic, when UNICEF and partners also developed this IYCFE brief, which says, you need to take into consideration IPC measures, et cetera, et cetera. But then this is more of the operationalization. So these tools are operationalizing these recommendations and guidance. And so it makes them really, really important. And to also emphasize, for example, for the digital platform and that word that Alex mentioned, the place to go. I think this is what we need, right? We need to know where to go when we're faced with an emergency and when we want to help. So I think in that context, it's really important. And in the context of also addressing the gaps and challenges. So these are very much, to the point, and they address the need that has been identified. So thank you.
Thank you very much, Linda. That was really helpful. And yeah, just to underscore again that these tools are published for everybody's use, for anyone who they can help, which we hope is many, many people. So perhaps that we can return as well to Andrea and Olive and follow up on some of the challenges that you mentioned earlier in the panel. Andrea, you mentioned about the challenges related to IYCF counseling and that one-on-one relationship with mothers. Can you speak a little bit about how you see these tools addressing some of those challenges?
Hi, Sarah. Yes, thank you. I want to mention that thank you for all the people who give this to us. I can say it's the library of our dreams. It's amazing. Thank you very much. It's the library we need to organize what we want to do and what we are trying to do. About the challenge on giving counseling, e-counseling, I can say, and someone mentioned it in the chat, is that we have faced with mothers that answer the phone that they do not trust in us or they may not trust in us. So the guidelines that you have developed for us give us some tools and remind us the importance of the communication skills, to make open questions, to present ourselves, who we are, why are we calling, how do we obtain their data, and yes, why are we calling, and trying to make empathy. So I think it is hugely valuable for me and for the team that is making these phone calls. We are going to have like the guidelines to have a better relationship with these families, with these mothers, through a simple phone call. So thank you. I am impressed of everything, and I am really, really happy of all these resources that we have and that are in Spanish. So I am really excited because of that. It's like, I feel like I'm in a premiere of a big movie, but it is like a surprise. So thank you very much. Over.
Goodness, that's wonderful. I love that phrase, the library of my dreams, Andrea. Amazing. But I think you've touched on a lot of important aspects here, that when we're trained as IYCF counselors or breastfeeding counselors or simply public health professionals, rarely does that training extend to how you provide that service on the phone when you don't even see that person in person. So thank you for raising that it is a different skill set that we're all needing to become a lot more adept at. Olive, it's also a very strange thing to conduct support groups when you've got to maintain social distancing and reduced frequency and all of these so important, all of these precautions. Are there some ideas that you have related to support groups about how some of those challenges raised by your own team can be addressed with some of these tools?
Thank you very much. Yes, quite a number of challenges in conducting the support groups, especially in the context of COVID-19. And these, of course, there was a lot of adaptations and adjustments by the members of the groups as we made different changes, like breaking the groups to smaller numbers and accommodating new members from other groups to establish new groups. This all was a bit a challenge for us. And also we had the cost of operation increasing, because that involved lots of more days to be able to cover what we needed to cover, and also providing trainings that were not really planned for. So based on the tools that have been developed by the team, I must say that these are great tools that can be utilized at all levels. So for us is to adopt what works for us, and also translate those tools to a language that everyone can understand, to the local dialects, so that everybody can be able to understand, we can be able to communicate, and also clarify some of the issues that were raised during, as we implement IYCF and support groups at the community level. There are questions raised. Sometimes it's difficult to respond to them, but using these tools, once they are translated to the local dialect that the communities can understand, then it becomes very easy for us, even to project the videos at the community level. So I think this is work well done, and this will go a long way in enabling the IYCF interventions at the community level to be better implemented. Thank you.
An important comment there, Olive, as well, of course, that these videos and some of the information and the tools can be shown directly to parents themselves. And that is not even only just for frontline health workers, but also tools for frontline health workers to use themselves. Thank you for raising that. I also want to maybe follow on that question to Alex on how can many of the folks who have joined this call are themselves potentially nutrition advisors or supervisors in a health system. What are some ways that you would suggest they could support their teams or the folks, the frontline health workers themselves, accessing these tools or using these tools?
Yeah, no, thanks, Sarah. I think, yeah, I think there are several opportunities in programming. And again, I wanted just to emphasize, we are really focusing in context where there is an ongoing emergency, we are responding to an emergency, or there is a chronic emergency. I think it's also important we frame these tools within that context. So I think the very first thing that I'm sure our colleagues are already thinking, both from at the country level, is great, I'm doing, I was not doing, or I was afraid to do community support groups. Now I can review this guidance, I can review those suggestions, and I can start looking at how to restart, or how to continue, how to be more confident. Maybe I'm doing it and I don't have that confidence. There's a bit of fear also in the community. So that could be one way, in ensuring that we go back to our programs and see, okay, this is what I wanted to do, and I'm still a bit not confident in doing it. The other thing is also to think about things that maybe we were not doing it in the past, like home visits, and maybe we thought, because of COVID, that's also a good thing not to do, But the reality is, again, maybe in a context where maybe women are not going to the facilities, we know that there has been some issue about access to facilities, diversion of facility services, depending on the context, of course, maybe more or less relevant. If we do have community volunteers and community volunteers are trained, then maybe that could be a new strategy to ensure that certain key messages are reaching our caregivers. That could be a response to a specific issue that maybe we are experiencing. So again, I think there are diverse ways, but certainly go back to our teams. Let's see what is there. Let's see how it fits what we are doing, or how it can help improve what we are doing, or how it can give us an idea of doing things that we were not doing. And so the e-counseling, that I agree with Ellen, there is so much, Ellen Gray, there is so much experience in many contexts, maybe less, in an emergency situation. So that, I think that could be a start to think about, guys, we've been doing counseling face-to-face, but again, the situation of lack of access to population, unfortunately, we are seeing it in not just because of COVID, we are seeing it because of conflicts, we are seeing because of natural disasters, we are seeing because of political instability, where access is the first thing that is affected at the onset. It can be protracted. So it's not just because of COVID, So I really hope that this tool can encourage, can inspire the teams working in all the emergency in this world, and unfortunately there are many as we speak, to think about, let's continue face-to-face, but let's also prepare ourselves for this phone counseling or whatever support we can continue providing, so that we are ready whenever, unfortunately, access will be limited or interrupted, because these situations will be repeated in time, and we cannot just stop supporting, So I think that's more to inspire teams to say, okay, there is a way. We can prepare ourselves to continue that support. And again, there are so many other things that can be done, but these are some of the ideas. Over.
Yes, thank you for that, Alex. That's a critical point there, that although these videos were developed in the time of COVID-19, that many of the restrictions that we're facing currently are access restrictions that are faced in so many other contexts as well, in relation to so many other kinds of disease outbreaks, but also in terms of security or even road closures due to seasonality, for instance. So we hope that as you review these guidelines, as you look at these videos, that you also see ways that they can continue being useful and relevant in your work. And in terms of the functionality of them, we have so many very good questions coming in. I know the first question was around, and pardon me if this wasn't the intention of the question, but this is what I read into it, around the multi-sectorality of these tools and how other sectors beyond infant young child feeding could use them. And I wonder if I might just quickly send this question over to Alex, just in terms of your thoughts on how these could be relevant across public health sectors or other sectors as well.
Yeah, no, thanks for the person that asked this question, and I'm very short answer, and I would also happy to hear from our colleagues on the panel. But again, when we look at support groups, no, the guidelines. Let me also state that, and maybe I didn't state it, do not contain anything new about infant and young child feeding that we didn't know, but are mainly complementary to the existing recommendations. So it's really more about how to support groups, no? So in contexts where there are groups around HIV or there are groups around other maternal health issues, I feel very confident to say that this can be applied, those recommendations, because the main objective, for example, of the guidelines is really to how do we continue the activities, facilitating support groups, meeting members of the support groups, reassuring everyone of compliance to COVID-19 recommendations, but still having meaningful sessions, no? So the guidelines is really complementary, are meant to be complementary to the existing mother support groups, mother to mother or father to father support groups in infant and young child feeding. So one is, please don't be afraid, don't be worried that is because we call it IYCF, it doesn't mean that it's only IYCF. It's really to provide a general set of recommendations on what things need to be prepared, what we need to be conscious about, so that again everybody feels more confident that yes, we can do it because we are doing these things. And so any other public health intervention that has similar intents can apply those recommendations. The more so the e-counseling component. No, again, we are not. This is not an IYCF counseling guidance. It's not. There will be several coming out, and Linda can announce it. And I won't say anything about that. But the bottom line is, it's not about how to do counseling and what is the physiology of the breast and so on and so forth. It's really about what happened or what to expect when you are on the phone with another a mom or a caregiver, and what are the main differences and concerns because you are not face to face. No, you cannot see the mother. How do you try to observe using your voice and using certain questions, the same thing that you were observing just by looking at the mom and the child. No, so it's again, it can be a way of doing remote support for any program where an health worker or community health worker wants to provide that continuous support and reassurance, no, to their community. So again, I think this has been the approach when developing these guidelines. But again, I'll stop here and give the floor back to you, Sarah. Maybe again, I'm sure Linda has much to add. Over.
I will actually just, we have about 4 minutes left on the webinar. We want to respect everybody's time. So I might suggest that we'll ask one final question to Linda, Olive, and Andrea to close, and then I'll just try to wrap up quickly at the ending. There are a number of good questions that came through, particularly around, well, many questions overall, but there are a number around the functionality of the IYCF eHub, for instance, that I think we can probably develop into a FAQ and load that onto the website in terms of real-time response, translation of the guidelines, things like that. So we might not answer them in the webinar themselves, but they will be available on the IYCF info. So just to close, I think let's return back to mothers and care providers during this time of COVID-19. This question is for Linda, Andrea, and Olive. In your experience and in speaking with mothers, speaking with frontline workers, speaking with organizations supporting frontline care, what were some of the challenges that were raised to you by parents about infant feeding during the COVID-19 pandemic in particular? And it's open to any of you that would like to respond. We're really trying to bring the experience back to parents to remind us of our important clients.
Hi. Oh, sorry, Linda, you go.
Okay.
I would say that the parents were and are worried about the risk of passing the COVID-19 through the breast milk to their babies. So it is really important to support them and explain them why not that could be possible, and if they have COVID-19, how they can act or prevent this transmission of this disease, of this virus. Another difficulty, when we are calling only by phone, they may have difficulties and they may have we would need to see the scene, like to evaluate if they are having this good attachment or not. So as we are not seeing them, they have to describe us the situation. So that is a challenge. So what we are trying to do is showing or making examples, how can they describe us the situations, so they can also make that exactly description, so we can make an imaginary, because as we are not seeing it, we have to make an image. So that is what I would say that are the difficulties we have had. So many others, but this for now. Thank you.
Thank you, Andrea. All of you also had come off of mute.
Yeah, in addition to what Andrea said, is that for the caregivers or the mothers that had the fear of transmitting COVID-19, we also sensitize them on the need of using the face masks in the event that they have either the symptom, they are coughing, or they are COVID-19 reactive, so that they cannot transmit it to the caregivers. Also, based on the research findings that were shared, we were able to provide information based on facts that we've not had any case of COVID-19 transmission from a caregiver or from a mother to an infant. Thank you.
Thank you, Olive. And Linda, any final thoughts?
Maybe just, final thoughts about the challenges of the mothers, just bearing in mind that eventually this is what we need to, make successful for the infant feeding to succeed. I wanted to add also the challenges that are faced at the hospital or at the delivery premises. It is a concern for mothers, the separation that was separating mothers and babies in delivery facilities, and that was really as a result of existing policies at the different countries in different countries. So that is a concern for mothers, but also it's a practice issue, right, at the healthcare level. And just to go back to the tools, they are also an opportunity to address the healthcare provider, right, to raise awareness about the proper practices, because it all revolves around supporting the mother and the child to be able to successfully feed their infants based on their decision, right, and promote the optimal feeding practices. So I wanted to mention that. And I also wanted to just quickly, I saw a question about any positive or negative impacts, right, that the COVID pandemic. And I wanted to say that I would say a positive impact, of course, is the development of these tools, and also the thinking around you know, how do we counsel remotely? Because as you said, Sarah, this is not only for COVID, this is also for other contexts. And a positive impact was there's a study we know that was done also that mothers are asking more to breastfeed, right? They're asking to be helped to breastfeed, for example, in Australia. So that was because they know that breastfeeding is positive for their infants. We know that there are also negative impacts such as the mother-baby separation. I'll stop here and thank you.
Gosh, we could double the time of this webinar. We just got to the juicy stuff, I think. Well, thank you very much to all of the panelists, to Andrea, to Olive, to Linda, and Alex. I know that we are just a few minutes over, so I'll just wrap up and again express my thanks to you, to all those who participated and sent in your questions, and to everybody involved in producing all of these tools, to our strategic advisory group, to our donor USAID, BHA, to all of the many reviewers who contributed, and also to those who contributed originally the original source information and helped to share the challenges and some of the successes that were being created in terms of direct service with mothers and care providers. We also do want to thank Save the Children Sweden that is supporting the IYCF Hub, and importantly to Ready for partnering with us on hosting this webinar. So our sincere gratitude. We hope that you find that these are useful tools for you. All of the links will be shared, which Ryan is in charge of, so through the magic of technology. And just once again, thank you very much. And we hope that we hear from you that you have good experiences with these resources. Thank you very much.